This podcast is brought to you by North Carolina's electric cooperatives.
This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Campbell.
Thank you for joining this week's NC Spin. Well, the topic on everybody's lips right now is the coronavirus epidemic and the impact it might be having on our state. So we're going to air an exclusive interview we conducted with NC DHHS Secretary Mandy Cohen earlier this week. She tells us what to expect and what we can do about this, and then our panel is going to sound off on various aspects of the coronavirus. Now, speaking of the panel, this week's panel includes Bob Orr, former Supreme Court Justice, John Hood, syndicated columnist and author, Chris Fitzsimon, director of State's Newsroom, and Howard Lee, former state senator and chair of the State Board of Education. We'll begin our interview with Secretary Cohen after these brief messages from our underwriters.
Tools make you a real DIYer, and as a member of an electric cooperative, you have lots of valuable tools to help you do it yourself in controlling your home energy use and budget, leaving you free to be Dad.
The big issue in 2020 is healthcare. Let's talk basics. You are the key to your own personal health, but there is strong evidence that if you have a relationship with a family physician, your quality of life will be better. You'll likely live longer, and you'll have 33% lower healthcare costs. Your family doctor knows you, has your medical history, and can quickly diagnose health problems. Family physicians, your trusted healthcare advisor for life.
Secretary Cohen, I know that your life must be just very hectic right now, so we appreciate you taking time to speak to our audience. COVID-19 or coronavirus is the main topic of conversation wherever you go today. It's on everybody's lips. There are some who are saying that the media is overhyping this and sensationalizing the coverage of this. How much of the hype is legitimate and how much of it is real?
So what I would say, I've been getting that question a lot. Why should we care? Should we pay attention to this? And what I would say, particularly in the last couple of days that has been worrying me is as I watch the disease progression across the world, we sort of saw what happened in China, but now seeing how quickly things progressed in Italy, for example. They went from 600 cases to locking down their entire country in 11 days. Coronaviruses, there are actually multiple versions of coronaviruses. Some of them have been circulating for many years, and others of coronaviruses we've heard about before. SARS, MERS, those are coronaviruses as well. This is another new coronavirus the human population has not seen before. So that means there is no immunity to this new coronavirus, which is now called COVID-19. And that is the reason for concern here. One is because we're seeing how quickly it is spreading. That is pretty contagious. And again, no one has immunity. And the other thing that gives me pause is unlike the flu, where we have both the flu vaccine as well as flu medicines like Tamiflu that we can give folks if they become sick. With this new coronavirus, we have neither of those. We don't have any medicine and we don't have vaccines.
Governor Cooper called a state of emergency on Tuesday. Now, typically when a state of emergency is called, there's a storm that's getting ready to hit us directly, right, or we're trying to recover from a storm that has happened. With only 7 cases known at the time, why did the governor declare a state of emergency?
Yeah, so I'm very thankful for the governor taking a very aggressive posture here to protect North Carolina and to make sure that we are as prepared as we need to be. And this is about preparation. We want to declare that early so that it allows us to mobilize the resources we need to now while we still have time to prevent some of the spread.
He said it would remove some barriers for people getting treatment. Explain that.
Yes. So it gives us some flexibility in a variety of ways. So it gives our state health director, who works for me, Dr. Betsy Tilson, some authorities to make recommendations like we did yesterday about moving to telework, work about recommendations related to large mass gatherings. We want those flexibilities to be able to help people understand how to manage risk and to slow the spread of infection. So yesterday we did, along with doing the executive order, we did issue new guidance that we want folks to be following. And we're at the point of recommend, but the executive order does give us the ability to say you must, and potentially we may get there. We're not there yet. We're still at recommend, but we may get to you must.
Is it true we don't really know how many cases there are in North Carolina because we haven't had the test kits that were available? And if so, how is that coming along now?
Yeah, let's get into testing. So we do have 7 positive cases as I sit here today. I bet by the time this is on air, that will likely be different. I do expect to see more positive cases. So the issue with testing, and I want to be clear with language here because test kits have gotten us all confused because there are different parts of testing. There's the part of testing that's actually taking the sample from the patient. You swab their nose, you swab their throat. We have plenty of that. We can swab plenty of people. The issue is when you get to our lab and we want to run that swab, that sample on our machine, we need a particular supply of what's called extraction kits. We need some chemicals, reagents that help us break down that sample and get the DNA out and allow us to know whether or not you have COVID-19. And it's extraction kits that is our rate limiting step.
I've read that the coronavirus, you may be in contact with someone with it, and it may be days before the symptoms actually materialize. So what should I be looking for?
Great question. One, I would say you're still learning about this virus, and everyone, it seems, is a little bit different. But on average, the kinds of symptoms that we're seeing for coronavirus are mainly 2 buckets. One is fever. So we're really not, fever is a really big indication. And then what's called a lower respiratory illness. So in your chest. So issues with cough and difficulty breathing.
And it's a dry cough.
It's a dry cough. So it's a cough and it's an inflammation in the lower part of your lungs. So people are like, oh, I have a little sniffle. I'm not that worried about that. Though again, we're learning, and everyone presents a little different. But what the criteria we are using are fever and lower respiratory symptoms and then people who are flu negative. It is still more likely if you're here in North Carolina that you're going to get the flu than COVID-19.
Yeah, we've had 127 deaths so far.
That's right. We haven't talked about that much because we kind of are numb to it.
Is it too late to be vaccinated?
No, please get your flu shot. It's not too late. Now, we are past the peak of flu season, which is good, but you can still get your flu shot.
So if I start presenting, as you say in the doctor's parlance, if I start presenting symptoms of fever and a dry cough, what should I do? You
should call your doctor. So before going into some place, we want to see if there is an ability for someone to potentially even come to your home and test you at home. So with some of these early cases, we're able to do that. Now that we're not going to be able to do that for everyone for a large number of people. But I would call your doctor first, or you call your local public health department, your county.
So don't show up at the emergency room.
So right, we want to keep people away. We don't want all of the germs to be together. So what I would say is, if you are having the symptoms, right, most folks are going to be able to take care of this at home. There's no medicines and there's no vaccine, remember. So the best we can do is just let you know that you have it. Support you at home, hopefully when you can stay home, and your body will self-recover. Most people will, that is how things will go.
Why is it that they're saying that people over 60 are more susceptible to this than perhaps even younger children?
You know, we don't know why the virus is more severe only in the older population. We are looking at data that we are getting from China, from Italy, and what we're seeing first cases around the world. And it seems that those that are above 60, we're saying the cut point's probably around 65. It's not that folks are more susceptible. It's just that if they get sick, the symptoms are worse.
And if they've had respiratory problems, there's
exactly.
pre-existing conditions. What are the pre-existing conditions that
Right.
might play into this?
So obviously lung disease is the most concerning to me because this is a lung problem, right? It's an infection that impacts your lungs. And so people with underlying lung disease are probably most concerned to me, as well as people with weakened immune systems. But the CDC put out guidance to make that even broader. So they are saying people with heart disease, lung disease, diabetes, and others, and as well as a weakened immune system. So they're trying to bucket it. All folks with chronic diseases have more risk. Again, these are levels of risk. They have more risk of having severe reaction.
You touched on something I think is very important. We need to be informed, but we don't need to panic. So if I want to know the latest of what's going on, certainly I trust you and Dr. Tilson and the governor in this. North Carolina is never better than in emergency situations. So where do I go to keep up with the latest information on this?
Thank you for that. And so please check back often. It's on the North Carolina Department of Health and Human Services website. So you can always Google North Carolina Health and Human Services and coronavirus, and it'll take you to the page. But it's ncdhhs.gov/coronavirus. And there's lots of information that is being updated
Constantly.
hourly, yes.
Yeah.
So
Right.
check back.
Any last words that you'd like to share with the people of North Carolina? Any message that we need to know?
I think that this is going to be a rapidly evolving situation. And so I'd say stay tuned for more information. I'd also say we need to approach this with as much compassion that we can bring to this as possible.
And patience.
And patience. Thank you, Tom. This is going to be a challenge for us. I hope that we are going to do enough early on so that we're going to get ahead of these things. I think we are prepared. We do have some weaknesses around testing that we are rapidly working to try to solve, but altogether that I feel like, as you mentioned, North Carolina, like we've been through a lot. And we've gotten really good at preparing and being ready to respond to these things. So I want folks to know that we are ready and are mobilizing to respond to this. Stay tuned for accurate information and treat each other with compassion and patience as we work through this.
And one of the big questions in any event like this is who do you trust? And I've worked with you and your department long enough to know that I can trust the information that comes out of DHHS. And on behalf of the state of North Carolina, I personally just want to thank you for what you're doing.
Well, thank you, and thank you for getting good information out there for us.
Well, we thank Secretary Cohen for giving us this important information. By the way, this was done at the state's Emergency Management Center. And as you could see, it wasn't the prettiest video in the world. We were having to get this into the back corner of a conference room because they're in almost round-the-clock meetings at the Emergency Center discussing this. At the time we recorded this interview on Wednesday, there were 7 known cases of coronavirus. As of Thursday night, there were 16. So it gives you some aspect of just how rapidly this can change. Speaking of change, the whole world changed this past week. But I want to start by going around the panel and just asking you, what were your reactions to Secretary Cohen? John?
Was very useful, factual presentation, the kind of thing we need to hear more of from local, state, and federal officials. The key word I heard that I want to underline is patience. She mentioned at the end about patience. The containment phase of trying to keep the virus from spreading throughout North Carolina, throughout the country, that's essentially over. It's too late for that. And so what we're in is the mitigation phase, which involves, with the social distancing, the canceling of events, closing of institutions. That's designed to slow down how quickly the virus spreads through the community. It's not going to prevent it, but it slows it down and flattens the curve out so that there isn't this spike of demand in hospitals.
As we've seen in some foreign countries.
So we have to understand that the precautions we're all being asked to take in North Carolina, they may not affect us very much in terms of our health. They may not keep us from getting sick. We may have never gotten sick. The main thing it does is it helps other people not just people who might get sick and potentially die from it, but it helps all the people that she mentioned, people that have chronic diseases, diabetes, lung disease, heart disease, who won't get the COVID-19, but need access to hospitals themselves for other reasons.
Yeah, keeps them out of the emergency room. Bob Orr, what was your reaction to Secretary Cohen's remarks?
I thought she radiated professionalism and credibility. And in this sort of atmosphere, I think it's critical that we have leaders and professionals who know what they're talking about, articulate it in an understandable and reasoned way, and gives the public a degree of confidence that they're getting accurate information and that the people providing this information care about their long-term well-being.
You know, Howard, I said we are never better as a state than we are in times of emergency. We rise to the occasions in North Carolina. Your reaction to her remarks?
I think she presented the information with great clarity, and as such gave me a sense of comfort that I probably hadn't felt before until I heard her with both an understanding and a command of the information and knowledge. I'm one of those high-risk people, being a diabetic. Certainly, I've been very concerned and to some degree fearful that if I do get impacted by it, it could be very damaging to me. But listening to her, I leave believing that even if I contract it, it may not be that bad, and I think that's what the public needs.
Chris?
Yeah, I'd echo everything people have said. I think we're lucky to have her with her background and her understanding and mastery of the issue. I also think implicit in all that is look to people like her, Dr. Fauci on the national level, who's now in the Trump administration, worked in every other administration, has been doing this for 50 years. Look to the experts, and we, as we talk about on the show often, we're in an era of bizarre theories and social media and panic. And there's certainly we need to be concerned. We don't need to be panicked, but we also need to look to people who know what they're talking about when we make decisions about our own lives and our loved ones, not to what's on social media or what a politician is saying for political gain. We need to look to the experts. She clearly is one. Dr. Fauci on the national level is one. These are the people. Dr. Betsy Tilson. These are the folks that we need to look to and listen to before we make decisions.
Guys, think about this for a minute. The world changed from the time I conducted this interview Wednesday afternoon until the time we take this show Friday afternoon. Think about it. We had the ACC tournament. Not only did they say they weren't going to have audiences, they canceled it. NCAA canceled the entire March Madness, all sporting events, professional basketball, football, universities.
Broadway shows have shut down for at least a month.
Right. When was the last time Broadway went dark for a period of time other than in mourning or something like that? Churches, the Methodist Church of North Carolina, the Episcopal Diocese of North Carolina have suspended services for at least 2 weeks. The whole world changed here. I asked the question when we first got started whether the state and all of these people are overreacting to this. After what we've seen and what we just heard from Dr. Cohen, what do you think?
Well, I think that the best case scenario is that we get some months forward and we look back and say, we overreacted. I mean, that would be fantastic because that would mean that the scarier scenarios
wasn't as big a deal as we thought.
That's what we want.
Yeah.
We don't want the alternative. I'm struck, and maybe I'm just living in my own unrealistic bubble or something, but I'm struck at how flexible and how agreeable North Carolinians have been to the requests, to the cancellations, to changing their lives, changing their child care arrangements in some cases, or changing their work arrangements. And I would think, I actually expect it to be harder to convince people to take these precautionary measures. I know there's been resistance and there's still dispute about school systems and things like that, but I think North Carolinians have been remarkably agreeable. I think they've been listening, they've been paying attention, and they have taken some significant costly steps in the interest of containing the effects of COVID-19.
Howard, the state of Maryland has ceased all of their public schools. Another state has done this also. We have Durham school systems, as of the time we've taped, and Chapel Hill schools that are suspending schools for the time being. But as Secretary Cohen was telling me in the long interview, this also presents some problems from the standpoint of, first of all, to try to keep any education going forward, we're going to have to try to do it over the internet. there are students in North Carolina who don't have laptops, who don't have tablets, and who don't have high-speed internets available. That's going to be a problem.
It's going to be a challenge. Certainly, I recognize that we have long known that if we ever got to the point of trying to educate online, it would be a challenge for a lot of students. Fortunately, we do have libraries now that are open, and students can, in small groups, go to the library and get access to.
If libraries are open.
If libraries are open. I don't know if they'll be open. But I think it's going to be a challenge. But also, having been in and out of schools recently, students themselves are more sensitive to recognizing that they may have to do extra work going forward than what they would otherwise.
And by the way, they're saying that students seem to be less susceptible to this virus than
children.
But as the secretary told me, Bob, if we suspend schools, then we're sending children home to grandma. And she's in the high risk zone.
Yeah, this is a set of challenges that's really
Like we've never
unprecedented.
seen. Yeah, we've never seen
absolutely. And I do want to comment on the question of preparedness. I think the testing issues that Dr. Cohen referenced, and we see in the news. We as a country, and maybe North Carolina as a state, both in dealing with these educational issues, I don't think we were really prepared, and I don't think this is the only time going forward that the country's going to have these kind of issues. We need to spend more money on public health, and the fact that the CDC budget's being proposed to be cut is alarming.
And frankly, the state budget originally had a $42 million cut in it for DHHS, which fortunately didn't go into effect, and they're now able to take advantage of. The whole concept here, John, is they want to try to spread us out so that we don't have contact with people. That's what's going to get the pushback, isn't it? But it is, according to them, necessary.
Of course, there's pushback. There's people who aren't perhaps making the best decisions, but lots of people are, and lots of people are accepting it. My point is simply, this is not a call. They have not called for everybody to stay bunkered to their homes for the next 3 months. That's not what they're proposing.
Yeah.
Well, and that actually would be very costly and have health consequences of its own. That's why these are not easy decisions. Like the school system decision is not an easy decision.
No.
Colleges were easier because these are adults. They don't need to be watched during the day. It's a challenging set of decisions, and we need to understand our leaders are facing them.
Chris, we came to UNC TV this morning. The parking lot was absolutely empty because all of the non-essential personnel are being asked to go home and try to telecommute. Secretary Cohen talked about that during the course of the interview. There are obviously people who cannot do that, but how difficult a transition is this going to be to keep things going from people telecommuting from their home?
I think it's certainly possible. I wouldn't want to be somebody thought of as non-essential. Maybe not a job that requires you to be physically present. There are some people.
That was a bad that was a bad classification. I'm sorry.
No, but I do think that's one of the mechanisms, one of the coping things that we have to do. There are a lot of jobs that you can do for some period of time at home. You have to increase communications. I think that's happening in the nonprofit sector and the private sector. I think that's going to continue as one way to do this. It is going to continue to require us to change our daily lives. I do agree. The vast majority of people simply are so far willing to do that. We'll see if we need further restrictive measures. That's going to be the challenge.
We need to commend the public of North Carolina at this point because they are treating this very well. Since the time we did this interview, the state has released some statistics showing that they now have enough kits to be able to test 700 people, which of course is far more than we've done so far. And they've got another 900 on back order. So if people start feeling like they might have these symptoms, they can get tested.
They can get tested, and I think somebody mentioned early on, we have to be patient and we should not be controlled by fear and react just because we get a small symptom.
I'm not sure that that's true in all cases. That's not. We have 10.5 million people in North Carolina. That's 1,600 cases. I still think there are protocols when you call your doctor's office. I'm not sure that everybody who wants a test, for example, can get a test. You have to be in certain categories and have been certain places before you're able to get a test.
Bob, let's take this out worst case scenario like this happened in Italy, where everything is shut down except pharmacies, drugstores, and grocery stores. We talked about the patients. How patient are people going to be if that scenario comes about?
Well, I think that's something that we need to be greatly concerned about. This overreaction of the public that can be driven by social media and false rumors and the like. And so it goes back to the leadership of our state and country in being able to bring a degree of calm and patience to it.
Couple of things that the Secretary highlighted in this, and we've heard it already, but wash your hands. Wash them vigorously, wash them frequently for at least 20 seconds at a time. And already people are telling me, I'm tired of washing my hands all the time. Well, I'll tell you what, it keeps the germs away. The other thing is to remind people about this website that DHHS has put up. I have been to it. It is a very thorough, very easy to navigate website, and it's telling people what they need to know. So the address for that again is ncdhhs.gov/coronavirus. If you go to that, you'll find out pretty much everything that you need to know. And I will further say we have the full interview of Secretary Cohen on our website. Well, this has been, I hope, an informative show for you. You've heard the spin that our panelists have given. To stay informed all during the week, sign up for our free weekly email newsletter. Give your feedback. Be sure to visit our website, ncspin.com, and join us next week when we take on issues of interest to the people of North Carolina. Until then, stay informed and watch out for the spin.
Today's tools make you a real DIYer, and as a member of an electric cooperative, you have lots of valuable tools to help you do it yourself in controlling your home energy use and budget, leaving you free to be Dad.
The big issue in 2020 is healthcare. Let's talk basics. You are the key to your own personal health, but there is strong evidence that if you have a relationship with a family physician, your quality of life will be better. You'll likely live longer, and you'll have 33% lower healthcare costs. Your family doctor knows you, has your medical history, and can quickly diagnose health problems. Family Physicians, your trusted healthcare advisor for life.
North Carolina Channel is made possible by the financial contributions of viewers like you who support the UNC TV network.